Hello, everyone. This is Farhan Tahir, and today I'm lucky to have Hassan, or more formally known as Dr. Ahmad Hassan Khan, who is our RMC graduate, our fellow, class fellow, who is currently an associate professor of general surgery at Sargodha Medical College. And today it is my honor and privilege to welcome him so that we can chat and talk about our memories of medical school and his journey of life. So, Hassan, welcome. Thank you for giving us the time and talk to us.
Thank you very much, Farhan. In fact, this is a big thing you are doing. I'm so happy to and excited to be here. And I have gone through all the 3, 4 interviews, and it is really turned out to be a lovely activity. So thank you from all of us, and I hope to have a good time, inshallah.
Thank you. We will. And I'm enjoying it as much as you guys are enjoying it, or maybe more. So let's start with our question that we try to start this conversation. What is the reason that you became a physician? You know, sometimes it's your parents pushing you, sometimes it's your own self. Share your journey of just the start of this life as a physician.
Yeah, so my answer would be almost just like this answer which earlier the class fellows are giving. So in our times, there were two things happening, obviously, that like 3 decades ago, there were not really many options we had apart from these 2, 3 known options of becoming a doctor, engineer, or getting into the army. So it was just the same. And in my case, because I was somebody who belonged to a city which is slightly a second tier city, Sargodha. This is actually 11th biggest city. So we were brought up in a concept that over here, you can only go for this becoming a doctor or an army person. So my father actually wanted both of us. We have two brothers actually, two sisters also, but both of us to go to in medical. But my elder brother, he somehow could not really get into it, and he was in army then. So I was the one who was left. So we had a typical first 12 years of studies like Kotaparni and Padhana, all those stuff. And luckily I had this merit for Rawalpindi Medical College.
What was your first choice of medical school? Was Rawalpindi Medical College your first choice, or you had found something like closer to Lahore or something?
I was always fond of Lahore. I mean, I'm going for the Basant and kite flying in my 7th class, 8th class. I still am a big fan of Lahore. So I want to go to Lama Iqbal actually. And there's an interesting thing that my score was like 840 and the merit at that time for Lama Iqbal was 841. So it was only once.
So, but I thought so. You are a Lahori kind of guy, and that's why I improvised this question in there because I've not asked it to anyone else. So I was like, how come this guy was in Rawalpindi, the boring place? Okay, good to know. Why? And now we know you are a surgeon, which I could never be a surgeon. I'm not good at my hands, and I can't take the stress. But you chose to be a surgeon. Why did you choose this specialty? Share with us the reasons, and where did you get training after your medical school?
Sure. And the first part, the answer is very interesting. So to be honest, if you all recall, I was a typical traditional that hostelite student, which was like, I would say, to be safe in the second half of the class, which is not really very, very good academics, or not really interested because of the reason that by वो क्या कहते हैं because
खिलाड़ू बंदे हैं आप.
Yeah, kind of. So by वो gender specific भी होती है ना activities के पढ़ाई में interested ना होना. So I was very average. So Alhamdulillah, went through all the 5 years. In house job, I was really thinking now of opting, and we used to have generally two options: getting into medicine and surgery. Not really many class fellows we used to talk in the canteens were thinking of neurosurgery or something like super specialty. But in surgery at Benazir Bhutto Hospital, I was really affected and really impressed by Dr. Ibrar Qureshi, Associate Professor, Surgical Unit 2. And he is the only reason that I chose to become a general surgeon. And he was like, you were really in love with that person. So
which hospital was it? Benazir Bhutto, you said?
Benazir Bhutto, Rawalpindi General Hospital in our times. Rawalpindi
Central now it's Hospital. Called Benazir Bhutto Hospital?
It's called BBH after the...
okay, I did not know that. Okay.
Interesting. Yeah, that Murray Road Hospital.
Okay.
So it was all that. So till my rotation started, I was really in two minds. But by that time, I was thinking of moving on for FCPS. It was just Dr. Ebrar, that role model, that impression. Till today, it's been 20 years, and I am really, really, the only reason I became Justin was just his personality, the way he used to work. So this is purely a role model based decision.
Very nice. Um, I would like to now add to that inspiring person that you met. Has there been an event during your residency, during your training as a surgeon that changed you or made you think how to practice surgery?
Absolutely. And this is not really a good one, but I would definitely love to share it. So as I'm saying that as we were growing into the house job, so the more you are exposed, the more you grow, the more you reflect. And now there was the time that you started becoming a little more serious about becoming a better person, a better at academics. So I did my part one FCPS in first attempt, which was pretty much the thing happening in those days. So you do a typical 4 mahine ki padhai, and then
Yeah.
you end up having a part. So I did that. It was fine. I started my FCPS training with Professor Dr. Asif Zafar Malik, and to be honest, I was again right. Almost at an average level trainee. But this one good day, I had this huge hard by Professor Asif Zafar. You don't seem to be interested, and you're just one of those who really want to have this time, and you'll never become a good surgeon. And I'm telling you,
Wow.
I remember that patient, transvesical prostatectomy. I remember almost the time. I'm not one of those who really remember the earlier things right exactly. And that jhar and that Usa Vasazaf honestly slowly changed me. And it looks strange. It looks really good, but I'm telling you, by the end of 3 years, if anybody asks of that tenure in Holy Family, I was, alhamdulillah, one of the good best trainees of surgeries. I had,
Hardworking, passionate, determined surgeon who works on his
yeah,
skills. I have to tell you
yeah,
that this is a good way for us to see that, you know, when somebody gives you a real feedback, honest feedback, it is good for us to take it positively, and maybe it can change our life around. And that is a great story. Thank you for sharing. You mentioned about that patient who sounded like a some kind of a urology patient, but you
yeah,
stick with the general surgery. Is that true? You're
yeah.
still working on general surgery as your major operations?
Interestingly, in those times, urology was part of a general surgery ward. This is
Yep.
2001 to 2000. So interestingly, in Holy Family, there was no urology unit. So I was trainee of intern of general surgery and department, but we used to do a lot of urology also because of unavailability. So this is 20 years ago. So this used to happen there, not now, obviously.
Do you do urology now in your practice?
No,
Not at all.
no.
Okay.
I did that. I did that for the earlier part of my professional practice, but then I left it, and because I'm a little busy here with my general surgery, so I don't do that. And by the way, just I moved on from Holy Family to back to my hometown. The moment I did my part two in 2004, I was lucky enough that 2005. I was lucky enough that I had this news that in Sargodha they are opening up a public sector medical college. And what happened was that I got the chance to get selected as a senior registrar in 2006-7. And from there, it is as smooth, as simple as anything. From there, I became assistant professor. 5 years later, I became associate professor. And inshallah, in 2022, I'll be, inshallah, promoted to professor. Inshallah.
Mashallah. So you got into inspiring people, business of inspiring people right from the get-go. And
Yeah.
some of us are still trying to see if somebody would come and listen to us. But that's great. I mean, the doors opened for you, and the opportunities come, and you went back to your own city, serving your
Yeah.
own people and your community and making a name. So I think everyone must be so proud of you. Let me ask you one more thing. Um, Based on a surgery patient, so laparotomy, appendectomy, is there any specific surgery that you find that you do more? Like I have a friend who does hernias more, you know, and Naveed told us
Yeah.
he does GYN surgeries. What is your niche within general surgery?
I was lucky enough to get a 6 months training at Shaukat Khanam Cancer Hospital in the general surgery department, oncological department. So I did learn a little bit of oncoplastic, not exactly oncoplastic breast surgery, but a lot of breast cancer surgery. So I do a lot of breast surgery here at Sargodha, and we can say kind of I'm known for a little bit of more of doing breast surgery. So I do a lot of breast surgery, which exactly is not big time breast surgeries, but obviously from lumpectomies to wide local excisions to MRMs. So a lot of cancer surgery, sometimes a little advanced surgery. So I have a little bit of interest in breast cancer surgery.
Tell us a little bit about your hospital, your surgical center. What kind of equipment and ORs do you have?
Yeah, so we're talking about the public sector or my own personal one?
Wherever you perform your surgeries right now.
Okay, so one is obviously at the DHQ hospital. This is a fairly big hospital. This is the biggest hospital of the city. This is a 700-bedded hospital. So we have a big OR, a typical OR, which has almost like 6 operation rooms, and OT, which have rooms. And we have almost everything, like, for example, from basics to pretty much advanced laparoscopic surgery equipment. And we do that also. Like, for example, lap cholecystectomies, lap appendectomies, a bit of lap hernias, sometimes a little bit of colorectal surgery. And at my private hospital, this is slightly limited one. So I have the small place, like 10 to 12 Merla space. So I've got 6 beds, nice, neat and clean hospital. And over here also it goes like the same. I don't do a lot of emergencies because I'm the only one actually taking care of your hospital.
More elective surgery would you do here? I read reviews on patients on Google that a patient had an appendectomy at your center, and they said that your hospital was the cleanest hospital that they could find, which is really good, because infection is the scariest thing after surgery. Post-operative surgery. So I'm so happy to hear that my friend there is running his own independent surgery center or a hospital, and people are loving it. That's great. And you mentioned briefly about your wife being a physician. So is that are you the only physician or surgeon there, or she also works with you and you have a group of doctors?
It's actually 2 of us, to be honest.
Okay.
This is like
so it's a private setup that you guys take care of. Wonderful. Let me ask you. So, I guess you have 2 jobs, just like most physicians. They have a teaching job or a government job or a hospital employed job, and then you have a private job. How do you divide your day?
So it's not really our choice. Our working time in the government sector is from 8 to 2. We work 6 days a week. It's not Saturday, Sunday off like in America or in England. So we have to work for 6
days a week. Okay.
Yeah. And obviously sometimes Sundays, because you can't say no to your private practice patients on Sundays. So so at 2 o'clock, I come back, take a quick small lunch, and then I work till 7 p.m., which includes my OPD patients and elective book surgeries. So by 7, I just leave for this health club and do a little bit of squash at this age with this weight. And
wonderful.
This is almost.
So surgeons are notorious to get up early in the morning. What time do you wake up?
Yeah, I'm almost a typical surgeon. I get up by 6:30. What may. Somehow, and I'm early to bed person also, so that makes it very simple.
I've seen some of your Facebook posts. You have a big entourage with you when you are in the hospital. A lot of residents and house job staff, right? So you don't have to do, thankfully, any scut work. You just go and perform your surgeries, and they do the notes and they do the dressings and everything.
Yeah, exactly. To be honest, in typical Pakistani head of department thing, I mean, you go there and it is all up to you what amount of work you want to do. Obviously, this is the only teaching hospital in this district, and this is quite a big district. So I've got like something like 12 to 14 house officers, like 10 postgraduate trainees with me. I'm luckily, mashallah, CPSP, College of Physician Supervisor in General Surgery for the last 1 decade, from 2010. So I've trained around 25 PG trainees. And,
wow, so 25.
So, and to be honest, the more we get older and busier, we're not really into working a lot, like especially the cut work. So these guys do a lot of work, and we sometimes go in and do a little bit of 1-2 surgeries. Otherwise, they're really fond of it.
So currently, the attractive part of this job, what would you say that, know what, I found my niche. This is what I really wanted to do.
Teaching to the undergrads, teaching to the postgraduate, you won't believe I'm a very different person. Anybody has any amount of knowledge of my 5 years RMC, I am an upside down person. I am telling you, I love teaching, and I am humbly saying, you ask anybody, I'm saying anybody from Sargodha Medical College, 10 batches have passed, they would be knowing me and they would not be having bad views. I love teaching. It's my passion. And I'm like, I
You
just love it.
you
So
are
I'm more of a,
and you know
yeah.
what, surgeons are really scary sometimes. Honestly, I still remember I used to get intimidated by them, but a surgeon like you, I think, would make anybody be interested in at least trying it and not be afraid of failure, right? uh, so that's wonderful. Is there any career interest or projects underway that you would like to share with us? Like, I'm thinking I want to bring laparoscopy to my own clinic, or I want this machine in my clinic, or any project that can uh, make a difference
There's
in
one,
your community.
yeah. One interesting thing which is happening with me is like, I was lucky enough to get registered with a master's program in health profession education, a proper medical education program. You all know that. In 2016, and I was lucky to get entry into a program. So it's a 2 years full-time master's degree, and I was lucky enough to get it with a very good GPA. I'm, mashallah, the only master's in health profession education in all three medical colleges of Sargodha. We've got three
Wow.
colleges. So I've been involved in a lot of, like at my level, and for the last 2 years, in uh, really doing, performing, and contributing the medical education part in a real hardcore manner. So I mean the curriculum thing, the integration ladder, the hard and all those things. So I'm really shifting slowly towards really doing the education part for whatever time I have left in my life, to do it in a proper structured way as much as I can in Pakistan. So I'm lucky, said that I'm part of the medical education team also. We all know that the Department of Medical Education is a separate department for the last 10 years in medical colleges. So I'm the only one, so I take care of that also. And I do a lot of whatever I can, and whatever, because of the politics, I'm allowed by my principal. So
Wow.
yeah,
So
I do.
give an example of a topic that involves medical education, which makes it different than what we went through the medical school, just to make me understand a little bit better.
Oh, just one liner, student centered. That's it. Khalas. The only thing these days they're talking about, that this is student centered. The teaching learning process is no more like I come and start talking for 50 minutes about a laparoscopy, cholecystectomy, appendicectomy. This is no more. Involve the students more, do more SGDs, a smaller group discussions, and just you would be amazed to see students coming up with lovely concepts, even better knowledge than you. So it's no more about delivering a knowledge. The transfer of knowledge is old days concept. It is they should come up with creating a few ideas. And really, I practice that because of my background of medical education masters, and it's good. It's
Hassan, you
amazing.
have told something that I honestly have not heard in America. We have heard about something called patient empowerment, patient centered treatments, because we always worried about, okay, how patient will utilize our services, how we are going to be rated. But you have coined a new term for me, at least, that student centered education. That's unique. That's great. And I'm so proud of actually you doing it, or actually sharing that with us, because I have not heard it. That patients, I'm sorry, the students driven focus of education. We'll come back to that. Maybe we'll have a more session on how you can teach us to be a better teachers and mentors. Now, is there any hurdles, biggest hurdle or challenge that you face every day, that you feel like that if you had a talk with Imran Khan today, and you like, and he's your buddy, and he's like, Hassan, tell me what you want to fix, I'll fix it for you today, what would be that?
I think my answer would be as same as anybody working in a public sector in a government setup job. So so I'm like, out of the whole team, I am actually at number two. I have one person who's senior than me. So then I have got 3, 4 assistant professor with me, and then. But I really feel that sometimes you're not really allowed to really deliver, perform, because of the strangest of comment that maybe the senior person doesn't really have that much skill or that much knowledge. And I would apply that for the thing which I did with my own savings, which is like something like close to ₹1 million for 2 years time. I saved that money, and then I spent, added a master's. And to be honest, one liner, I'm not really being involved by the seniors in the medical education. I didn't want to do that. There was no compulsion. I'm going fine, inshallah, and hopefully I'll be crossing the last hurdle of promoting to professor. Fine, last 14, 15 years. I thought 4 years back to contribute more because I have taken so much from my medical college and my city. So that I do a little bit of real and hardcore medical education. But I find that this one thing is always there. Your seniors really discourage you. and it is really difficult. Believe me, I do at least one workshop every 2 months in all the medical colleges around me, like in Faisalabad, and I am hardly allowed to do a workshop around medical education in my department. I don't know if it goes to YouTube and what happens to me, but to be honest, so this is really difficult.
I
I'm not
I
saying I'm
think I
good,
think
but
that that is a great point that you raised, because um, there is no shame to admit that, that you as a person overall, the aim that you are trying to deliver is better education and an environment that is more conducive for better learning, self growth. And I think that's a overall a great suggestion for a society to change the mindset.